Good afternoon, Dr. Douglas. Hi, my name is Joe Godding. I will be speaking about what is bronchitis. Bronchitis is an inflammation of the bronchi, the air passage that extends from the windpipe into the lungs. Most individuals do not realize they have bronchitis till it is too late. Bronchitis can be either an acute or chronic illness. Anyone can catch bronchitis, that includes you. I will inform you about the causes, symptoms, treatment, and most importantly, ways to prevent chronic and acute bronchitis. I will first inform you what causes acute and chronic bronchitis. Acute bronchitis evolves from a severe cold or sometimes it accompanies the flu. In most cases, the same virus that causes the common cold or flu also causes acute bronchitis. Research shows that bacterial infections is a much less common cause of acute bronchitis than we may think. It is very rare that infection caused by a fungus can cause acute bronchitis. 90% of acute bronchitis infections are viral organ. Only 10% are bacterial. Acute bronchitis can also result from exposure to smoke and certain chemicals. This can irritate the bronchial tubes and result in acute bronchitis. Chronic bronchitis, on the other hand, is an extensive mucus section in the bronchi. Chronic bronchitis has fewer causes than acute bronchitis. Cigarette smoke is the main cause of chronic bronchitis. Chronic bronchitis may be from recurring series of acute bronchitis or from heavy smoking and pollution in the environment. Smoking marijuana is also another dangerous thing for chronic bronchitis because it causes the patient to cough a lot. People who have been exposed to dust, chemical fumes, and other related substances over a long period of time have a great chance of getting chronic bronchitis. In most cases, the symptoms of acute and chronic bronchitis are tricky to discover. How do you know when it is time to contact your doctor? Bronchitis symptoms are most commonly compared to the flu and the common cold. A cough that is frequent and produces much mucus, a lack of energy, chest congestion, and a fever are all symptoms of bronchitis. Acute bronchitis generally lasts for about 10 days and if allowed to become severe, will eventually become chronic bronchitis. An ongoing infection caused by acute bronchitis can become chronic bronchitis. When should you contact your doctor? If a cough persists after your cold is gone, then you should contact your doctor. You might have bronchitis. If you have a cough that frequently produces yellow or green mucus and lasts longer than 2 days with a fever of 101 or higher, you should contact your doctor. It is advisable to seek prompt treatment to avoid serious complications. Drinking plenty of fluids is very important to the body. You will be going through a lot of flu-like symptoms. Drink a lot of fluids to keep the lining of chest and mucus free and liquefied. Some good liquids are herbal teas, 100% fruit juices, and water, also orange juice. Try to avoid alcoholic drinks and soda. Drink, Drinking plenty of fluids will help you from becoming dehydrated. The most effective way to rid of bronchitis is to stay indoors when the temperature is very cold. Always consult a doctor for proper treatment with bronchitis, especially if the saliva and mucus producing by coughing comes out yellowish or greenish and thick. Over-the-counter cough supplements will help to loosen the mucus. Robitussin, Borasan, and Mucinex are some over-the-counter cough supplements that can help with bronchitis. If over-the-counter medications does not make your bronchitis get better, seek professional help immediately. You may need a prescription from your doctor. Patients who suffer with either acute or chronic bronchitis should try to maintain a proper diet and live a relaxed and stress-free lifestyle. The use of medication that is prescribed by a doctor is also very helpful. Even if you feel better, don't stop taking your medication till your prescriptions are done. Doctors may have to prescribe antibiotics agents to reduce the inhalation overactivity. There are a few ways to protect yourself from getting bronchitis. Avoid smoking and secondhand smoke. Avoid cold damp locations and get your annual flu vaccine. Get a humidifier for your bedroom. Warm, moist air helps reduce coughs and loosens mucus in your airways. If you work in certain environments, use of protection devices such as a respirator or a filter mask will also be helpful. Anyone can catch chronic bronchitis or acute bronchitis. That includes you. I hope my speech on bronchitis will help you in the future. I hope you now understand what bronchitis is, how you can prevent it, what are the symptoms, treatments, and most importantly, ways to prevent chronic and acute bronchitis. Thank you.